So what are the initial thesis between you and Rajat to go after this market? I've read a little bit around being the WebMD for India and the Bharat audience. What was the real insight? I know Rajat also was working on something of a vernacular e-commerce platform, etc. Was that
Yeah,
where
yeah, yeah. So
you started?
yeah, so actually, Rajat already had a startup that he was running, which pivoted into becoming my HR. Um, so it was a e-commerce platform that sold Indian goods. So everything from Ayurveda to Indian clothes to Indian books to anything else artisanal. Um, and the website was entirely in English. When so one day he converted part of the website, specifically Ayurveda, into Hindi. And soon Ayurveda became 50% of his business. And that's when we met and we sort of double clicked into it and we saw that there's this huge, huge world around the need for medical information and the need for access to medicine. And when I say medicine, not medicines, but like healthcare, access to healthcare that is entirely unmet. And it overlaps very, very strongly with the language preferences of the population. So anybody who's primarily an English speaker or consumes their media in English, you see that they typically also have access to good healthcare in India. Not it's not 100% overlap, but it's strong enough where you think that there is something going on there. So the simple insight was that we're going to try to create content in Indian languages. It serves first of all that need in itself, and then we can go beyond that. And if we build a large enough audience, we can build a stack of services on top of that, which is what we did. So the goal was to go well beyond what WebMD does. WebMD is largely stay focused on a medical platform, and they try to make their money through advertising, etc., which is not the route we've gone. We've not tried to make any money on ads or anything of that sort. We are a healthcare company. We're not a media company trying to survive off of ads.
You know, when you look at the state of healthcare in India, you probably have the best view from the position you're in.
Mhm.
You know, it doesn't seem far-fetched to say this is a very required product, probably because as you know, today they call it the WhatsApp University, where people are sharing random things on WhatsApp, where people seem to believe it. It doesn't matter what the source is. And then there is organized players like you offering content. What are the things that really stood out in terms of the state of healthcare, state of people's thought process when it came to understanding uh, their medical needs? Uh,
Um, so, I mean, like the full analysis would take a while to dig into, but um, see, there is no structured data set available on mostly anything in India, let alone um, something like the healthcare needs of people in tier 2 and tier 3. So it was largely a huge set of heuristics. So you come at it from multiple angles. You look at what's happening globally. So there is WebMD, there is Healthline, there is Mayo Clinic. Together, at that time when we started, they were pulling 300 million visitors every month, and that's in a country where uh, yeah, that's quite a lot, right? So the population of the US is 300 million, and these websites together pull 300 million people. Sure, some of it is from abroad, but largely from the US. In a country where there is real healthcare, right? So despite having access to healthcare, people have the need for healthcare information, right? Um, and then you can, walk around the globe and you'll see that everywhere there is a health website which gives credible, legit medical information. There are a couple in China, there's one in Japan, there'll be one in every European country. Um, and that's true everywhere except India, because we, for whatever reason, we have that our web was entirely in English. Sure, there are some government websites which are in Hindi, but whoever got information of a government website, right? So it's not, you're not going to get it from the public sector. So it has to be from a private initiative. But there was nothing, and largely because it was guys like you and me who created the web in India, right? And we come from the English speaking world, right? As much as we're even talking in English right now, even though we talk about people who don't talk in English. So uh, when we create, what we have seen is the web in English. And when we set out to create it, we create it in English because that's the world we know. What we don't realize is that the world we live in is this big, and India is like, 1,000 times bigger than that. Um, it's sort of like saying, if you fly from Delhi to Bombay, uh, the world that you live in, the airplane crosses it in the first 3 minutes. The rest of the 2-hour journey is all Bharat. Think of it like that.
That's a very
And that's
interesting anecdote to kind of capture that.
that's exactly how I used to think of it when we started. Used to be like when I used to be flying into a city, I was like, okay, this is where I live, this is the world that I know. And the last 2 hours was entirely, a world unknown to me, or a world that we don't think about at all. And that's literally like that small a part of India. It's like a speck, you know, on the map of India.